Hey everyone, and welcome. Today, we are tackling a really critical topic, one that every single nursing student needs to master: HIV and newborns. And listen, this isn't just about passing an exam. This is about understanding how to save lives. So let's get right into it.
So here's what we're going to cover. We'll start with the basics of what newborn HIV is. Then we'll move into the risks and the signs you need to look for. After that, we'll cover diagnosis and the core medical treatments. Then, and this is the big one for you, we'll spend some real time on essential nursing management. We'll wrap things up with how to prevent transmission in the first place and the key takeaways. Sound good? Let's go. All right, first things first. Let's start at the very beginning. What exactly are we talking about when we say newborn HIV?
At its heart, HIV in a newborn is a viral infection that's passed from an infected mother to her baby. This can happen during pregnancy, while giving birth, or through breastfeeding. The official term is mother-to-child transmission, and it's so important to know that this is how basically all young children get HIV. Now check out this number. If we do nothing, no medical intervention at all, the risk of a mother passing HIV to her baby is somewhere between 15 and 45%. That is a huge risk. That's the problem we're up against.
But here's the amazing part. This is where good healthcare changes everything. With the right interventions, the very things you'll be helping with, that risk plummets to less than 5%. I mean, look at that difference. This right here is one of the greatest success stories in modern public health. It shows what's possible.
So how does the transmission actually happen? Well, there are three main ways. First, it can happen during the pregnancy itself, when the virus crosses the placenta. Second, it can happen during labor and delivery through contact with infected blood and fluids. And third, after the baby's born, it can be transmitted through breast milk. Knowing these three routes is the key to blocking them.
Okay, let's move on. Now that we know how it's transmitted, let's talk about which infants are most at risk, and more importantly, what signs you as a nurse need to be on the lookout for.
So a few things can increase the risk of transmission, but the biggest one by far is a high maternal viral load. All it means is that the mother has a lot of the virus in her body. The more virus there is, the higher the chance of passing it on. This is exactly why getting the mother on antiretroviral therapy, or ART, is so incredibly important. Other things, like being born prematurely, can also make the baby more vulnerable. Now, this is a really critical point. Most newborns who are infected look totally fine at birth. The symptoms don't usually show up for weeks or even months. That's why your role is so vital. You're the one watching for the early warning signs. Things like poor weight gain, infections that keep coming back, chronic diarrhea, and any delays in hitting those developmental milestones.
Okay, so you know the risks, you know the signs to look for. What happens next? Let's get into how we actually diagnose HIV in a newborn and what the core medical plan looks like.
All right, pay close attention here because this is major for your exams. We can't use the standard HIV antibody test on a newborn. And why is that? Well, for months after they're born, babies still have their mother's antibodies in their system, which would give a false positive result every time. So instead, we have to use a special test called the HIV DNA PCR, which looks for the virus's actual DNA. The schedule is super specific: one test at birth, another at 6 weeks, and a final one at 6 months to confirm. As soon as a baby is born who's been exposed to HIV, we start them on what's called prophylactic ART. Prophylactic just means preventative. The whole idea is to stop the virus before it ever gets a chance to set up shop. The two main drugs you'll see, nevirapine and zidovine, basically work by jamming up the virus's internal copy machine, so it can't make more of itself. The schedules might be a little different, but the goal is always the same: shut down the virus.
Okay, now we're at the part that's all about you. The doctor's orders are one thing, but making sure it all happens correctly, making sure that baby is safe and cared for, that is all about excellent nursing care. This is your critical role. Job number one for you is infection control, period. An infant exposed to HIV has an immune system that's still developing and is incredibly vulnerable. A bug that wouldn't even phase a healthy baby could be life-threatening for them. So your aseptic technique, perfect hand washing, using sterile equipment, keeping everything spotlessly clean, it isn't just a box to check. It is a literal shield that protects that baby from dangerous infections. Giving that antiretroviral therapy is a massive responsibility. It has to be done perfectly. We're talking the right dose at the right time every single time. And that therapy has to start within 6 to 12 hours of birth. That window is everything. There is zero room for error here. Your precision is what literally stops the virus from multiplying. These are powerful drugs, which means they can sometimes have side effects. Your job is to be the watchdog. You're constantly observing. We know some of these meds can cause anemia, so you'll be keeping a close eye on the lab results for hemoglobin. You're also watching for any rashes, vomiting, or if the baby seems unusually tired. Catching these things and reporting them right away is how we prevent small problems from becoming big ones. Growth is like a vital sign for these little ones. Is the baby gaining weight? Are their length and head measurements following the curve on the growth chart? A nice, steady growth curve tells us two really important things. One, the baby's body is healthy enough to grow. And two, it's a really strong sign that the ART is working and keeping the virus under control.
And your job doesn't stop at the bedside. You are a teacher. A huge part of your role is to empower the mother and her family. You have to make sure they understand why it's so important to stick to that medication schedule, how to feed the baby safely, and why they can't miss a single follow-up appointment. That education is what makes sure the good care continues long after they've gone home. Up to now, we've mostly talked about how to manage a baby who's already been exposed. But, the real win is preventing the exposure in the first place. So let's talk about the strategies for prevention of mother-to-child transmission, or PMTCT.
The whole strategy for preventing mother-to-child transmission really comes down to 4 key pillars. Step 1, screen every pregnant woman for HIV early on. Step 2, if she's positive, we get her on ART right away to bring her viral load way down. Step 3, we use safe delivery practices to reduce exposure during the birth. And step 4, the baby gets their own dose of preventative ART right after they're born. Each of these steps is like another layer of defense against the virus.
All right, how to feed the baby. This is a huge decision. The current guideline is that exclusive breastfeeding for 6 months is actually recommended, but only if the mother is on her ART and her viral load is undetectable. Formula feeding is only the right choice if a family can meet all of the AFAST criteria. That means it has to be acceptable, feasible, affordable, sustainable, and safe. And that last one, safe, is the biggie. It means they need reliable access to clean water, and they have to be able to prepare that formula safely every single time. If they can't, breastfeeding is actually the safer option.
We are almost there. Let's pull all of this together now and talk about what the future looks like for these kids, and then we'll recap the most important things you need to walk away with today. And this right here is the bottom line. This is the miracle that all this hard work creates. The prognosis today is just completely different than it used to be. With an early diagnosis and consistent treatment, a baby exposed to HIV can now expect to live a long, full, healthy life. You can really see the 2 paths on this slide. And the bright path, that's the one made possible by the incredible nursing care we've just been talking about. You help decide which path your patient gets to take. So I'll leave you with this question to think about. As a nurse, what's your most powerful tool here? Is it your clinical skill, your sharp eye for detail, or is it your compassion and your ability to teach and empower a new mom? The truth is, it's all of it. Your knowledge, your skills, and your compassion all rolled into one. That is the most powerful tool there is.